thrombocytopenia, growth retardation, and skeletal abnormalities. It can be broadly classified into 3 types. Type 1 is the most common, type 2 is the acute neuropathic form, and type 3 presents with aggressive systemic disease. We searched the literature, but till now we found no association between Gaucher's and microspherophakia. As we all know about microspherophakia, it's a rare disease with increased AP and reduced equatorial diameter. These are the conditions in which it has been seen, but there has been no reported case with Gaucher's up till now. The underlying pathology of microspherophakia in Gaucher's remains unclear. So the message is the ocular involvement in Gaucher's is comparatively rare, and this further adds to the spectrum. Early recognition is necessary to improving the quality of life, and further research is needed for better understanding the management. Thank you.
Good case, very nice case. Could you have managed it differently? Like, go back.
Ma'am,
how was the pressure of the eye?
Ma'am, pressure on ma'am, in 2019, 21, and 23, which time are you asking about?
No, after the surgery.
Okay, ma'am. After the surgery, ma'am, pressure was 24 and 19.
Okay.
So
in this, the lens was not put, no?
Ma'am, lens was not put, ma'am, because the patient was having bleeding disorders too much. So that was the reason we also didn't do peripheral, the PI, etc. at the initial setting, because the patient had thrombocytopenia, pancytopenia was present. That's why it was we record the GA consent also very it was because it took, like in 2021 we tried to operate, but there were so many GA investigations, the patient was lost to follow up again. So this time, like, we did this month.
Okay.
Thank you, ma'am.
So she was the third author, actually. She was the third, Dr. Afifa. So we can call the first, now we can go according to the plan. The first presenting author is Dr. Abhijit Misal for outcome and complications of retropupillary iris claw lenses in a pediatric population. Not present. Okay, then we can have the second. So second author is, so the second paper is retinal structural and microvascular changes before and after amblyopia therapy in children. Dr. Meghna Sethi?
Yes, sir. Okay. Excuse me, can I have a pen? Please start.
Oh, okay. Good morning, everyone. I'm Dr. Meghna Sethi from Guru Nanak Eye Center, New Delhi. I'll be presenting my team's work on the retinal structural and microvascular changes before and after the amblyopia therapy in children. There are no financial interests. So the aim of the study was to compare the structural as well as the microvascular parameters in the amblyopic eyes before and after the amblyopia therapy. It was a prospective interventional study that took place at our institute with 15 patients with unilateral amblyopia who were followed up for 3 months. So we assessed the retinal structural changes after 3 months of occlusion therapy using the OCT, in which CMT and retinal nerve fiber layer thickness was taken, and the retinal microvascular changes were assessed using the parameters such as the foveal avascular zone and the mean vascular density in the superficial as well as the deep capillary plexus. Patients aged 4 to 12 years and patients with either strabismic and isometropic or sensory deprivation amblyopia were included in this study. Patients with bilateral amblyopia and isometropic amblyopia, poor fixation or nystagmus with spherical refractive error of more than equal to 5 diopters or cylindrical refractive error of more than equal to 3 diopters. On patients with ocular comorbidities, history of prematurity or neurological disease or any systemic conditions, and history of any skin allergy or irritation to the bandage type occluders were excluded from the study, and the poor quality OCT or OCTA scans were also excluded. So we take the informed consent from the patient, and a detailed examination, history and examination was done. All the subjects were given the best spectacle correction, and full time patching therapy was given. The visual acuity, OCT and OCTA parameters were taken before and after the therapy for 3 months. Statistical analysis was done which revealed the following results. So the most of the patients in our study were in the age groups of 10 to 12 years. The distance best corrected visual acuity in the amblyopic eye at baseline was 0.44 logmar equivalents, which improved to 0.38 logmar equivalents at 3 months follow-up, but the p-value was not significant. The retinal structural parameters were assessed, and the central macular thickness at the baseline was 236 micrometers, and the average at 3 months was 222 micrometers. In this, the p-value was statistically significant. The retinal nerve fiber layer thickness at baseline was 126 micrometers, and at 3 months it was 116 micrometers. So the mean RNFL thickness in our study and the values in 3 out of 4 quadrants, it was found that it was thicker before the amblyopia therapy, and this difference was statistically significant. The retinal microvascular parameters, we assessed the foveal avascular zone. At baseline it was 0.22 millimeters square, which decreased to 0.21 millimeters square, but the p-value was not significant. The mean vascular density in the superficial capillary plexus at baseline was 27%, which increased to 36% at 3 months follow-up. This was statistically significant in the temporal quadrant as well after the amblyopia therapy. In the deep capillary plexus, at baseline it was 13%, and at 3 months it was 18%. This was also significant after 3 months. So it was overall a first such study performed exclusively in the Indian pediatric population, and it was a non-invasive method to study the effects of amblyopia on the retinal anatomy. But since it was a small sample size and single-centric hospital-based study, so generalizability was uncertain, and the follow-up period was also short, and also we did not differentiate between the types of amblyopia. So from this study, we concluded that the retinal structural and microvascular changes may precede the functional improvement in the visual acuity after the amblyopia therapy. It could also serve as a research tool to assess the effects of occlusion therapy, and the compliance of the therapy can also be assessed during the follow-up visits. Thank you, ma'am.
It was a nice study, but what does the literature say about it?
Ma'am, previous literature, it was suggestive that in the amblyopic eyes compared to the fellow eye, ma'am, there is increase in the CMT as well as the retinal nerve fiber layer thickness, and in the microvascular parameters, there is increase in the foveal avascular zone as well as the density is decreased in the amblyopic eyes compared to the fellow eye. So we just assess the changes that could occur after the therapy.
Okay, how did you calculate the size of the FAS?
Ma'am, on the OCTA machine, it is, ma'am, in the center, we have the FAS.
So how did you measure it?
Ma'am,
With the caliper?
it was calculated by the machine only.
Machine only.
Yes, ma'am.
And the superficial and deep plexuses?
Ma'am, that was also given by the machine, OCTA machine.
Okay.
NIDIC machine was used OCTA.
Okay.
Therapy, no?
Yes, ma'am. Ma'am, after the therapy also it was done. Ma'am, before and after the therapy it was
Go
done
back
at
to
the
your
baseline.
paper,
And
go back.
ma'am, where? Ma'am, the picture is only of the OCT, but we have taken the data from the baseline as well as after 3 months of the patching therapy. The mean was calculated, and it was then the difference was analyzed.
Okay. So only patching therapy only in one form of amblyopia. You didn't differentiate all the types of
No,
amblyopia.
ma'am. We have taken patients from all types of amblyopia.
What is the clinical relevance of this paper?
Ma'am, just to see if there are any retinal structural, anatomical changes following the amblyopia therapy, because in the previous study it was found that in the fellow eye there are changes. The fellow eye and the amblyopic eye was assessed of a patient with amblyopia. So it was a cross-sectional study. Ma'am, we have done an interventional study, prospective study, to see what are the changes after the amblyopia therapy.
Could be nice if we, okay. Okay, if we can find out which amblyopia, types of amblyopia,
Yes,
that would have
ma'am.
helped.
Yes.
Anyway, nice study, a lot of
Thank
work has been done.
Thank you.
So, okay.
So we come to the, do we have comparing biometric changes in aphakic and pseudophakic eyes after cataract surgery in children? Presenting author Dr. Komal Priya. No? Then a rare case of lipemia retinalis in a 6-month-old child with hyperlipidemia. Okay, a study on the role of omega fatty acids as an adjunctive therapy in treatment of amblyopia.
Can only say,
Okay, comparative
do
study
they know
of
that they'll be debarred?
Comparative study of 0.03% tacrolimus eye ointment to 0.05% cyclosporin in refractory cases of VKC. Dr. Shailja Kumari.
Yes.
Good morning, everyone. My topic of presentation is comparative study of 0.03% of tacrolimus eye ointment and 0.05% of cyclosporin eye drop in treatment of refractive cases of VKC. I have no financial interest. Introduction. VKC is common chronic bilateral recurrent inflammatory allergic disease of the ocular surface, commonly affect the boys, and male-female ratio is 2:1. Symptoms: itching, redness, photophobia, and foreign body sensation and lacrimation, resulting in visual disturbance. Conventionally, steroids are used for severe kind of allergic conjunctivitis, but chronic indiscriminate use of corticosteroid may lead to glaucoma, cataract, and secondary infection in the high steroid responder. Refractive cases are that show persistence of symptoms and signs despite of receiving topical 1% prednisolone acetate or use of systemic steroid treatment for more than 3 months, or cases in which there was relapse after tapering or withdrawal of the steroids. So now immunomodulator like tacrolimus and cyclosporin used in these cases. Subjects and method. This is the prospective clinical study done in 50 patients of refractive cases of VKC, in which 25 randomized to 0.03% eye ointment tacrolimus and 25 randomized to 0.05% cyclosporin eye drops. Aim of a study to compare the efficacy, tolerability, and safety of 0.03% of tacrolimus eye ointment and 0.05% cyclosporin eye drop in refractive cases of VKC. These are my inclusion and exclusion criteria. Methodology. All participants, guardian, or patient were provide written consent before the initiation of a study. The study protocol was approved by the Institutional Ethical Committee. All patients who satisfied inclusion and exclusion criteria at first visit complete general physical and ophthalmological examination like visual acuity, slit lamp examination, fundus examination, and IOP changes, IOP measured. Group 1 given eye drop, eye ointment tacrolimus 2 times a day, and group 2 given cyclosporin 4 times a day. Then follow-up done on 2 weeks, 6 weeks, 12 weeks, and 24 weeks, and evaluated for improvement in sign, improvement in subjective symptoms and sign, and any adverse effect in IOP changes. Scoring of symptoms and sign done by a scoring method in which maximum score of symptom is 9 and minimum is 0 as a total subjective symptom score and total objective sign score respectively. In total, subjective symptom score comprises only 3 parameters: itching, photophobia, and watering, where grade 0 comprises no symptoms and grade 3 is a severe form of the symptoms. Total objective sign score comprises 3 parameters: hyperemia, palpebral conjunctiva, hyperemia bulbar, and papilla. And again, grade 0 is comprises no sign, and grade 3 is severe form of the sign. Statistical method adopted for study were descriptive and statics and inferential statics. Results. Most of the VKC patients were 5 to 9 years of age group, and that is 56%, and 6% were above 15 years. Youngest patient in this study was 5-year-old, and the oldest one was 19-year-old. And in this study, 86% were males and 14% females. This is the changes showing the total subjective symptom score during treatment of tacrolimus and cyclosporin group on different visits, and both so on 4th visit 25% cases 100% cases so total subjective symptom score 0 in both the cases. This is table showing the total objective sign score in during treatment of tacrolimus and cyclosporin, and again tacrolimus group shows 100% improvement in sign after 4th visit, and cyclosporin shows 96% shows improvement of sign to 0 after the 4th visit. Discussion. In this study, 94% cases were between 5 to 15 years of age group, and VKC is more common in males, with male-female ratio is different study varying from 4:1 to 2:1. In this study, male-female ratio is 6.1 to 1. Tacrolimus eye ointment reduces the total subjective symptom score and total objective sign score 0 in 100% cases after 24 weeks of treatment in the refractive cases of VKC. While cyclosporin eye drop reduces the total subjective symptom score 0 in all cases, but total objective sign score 0 in 96% cases, while 4% cases have residual sign after 24 weeks of treatment in refractive cases of VKC. In this study period, IOP, lens, and fundus remain within normal limit. Only 1% of group 1 and 2% of group 2 reported a mild irritation which subsided during the course of the treatment. Conclusion. Both drugs equally effective in resolving symptoms, and that is 100% and sign 100% by tacrolimus and 94% by cyclosporin in refractive cases of VKC at the end of 24 weeks of the study. Tolerability of the both drug were good with negligible side effect. There were no evidence of IOP, fundus, and lens changes. These are my references. Thank you.
It was a nice study. So you gave a dose of cyclosporin 4 times a day?
Yes, ma'am.
Usually it is recommended twice a day.
0.05%.
Yes, you can give 4 times a day also,
Yes,
but
ma'am.
The irritation and the other symptoms might increase.
Yes, ma'am.
So it is known that tacrolimus is 100 times more potent than cyclosporin. So what did your study add to the literature?
Ma'am, we can use in refractive cases so that long-term side effect of a steroid can be escaped.
Okay, okay.
Actually, cyclosporin is also used these days in dry eye treatment as well.
Yes, ma'am. Yes,
So,
ma'am.
and most of the VKC cases also have dry eye also. What is your experience with this versus tacrolimus and cyclosporin? How do they affect dry eye associated with VKC in this case?
Sir, during treatment, it was improvement of watering symptoms. Patient have no, only few patients have irritations and blurring of vision in more in the tacrolimus group due to ointment maybe, and there is no any other symptoms like related to the dry eye I have experienced.
Thank you.
Thanks.
This is the next one. Please look up.
So next one is effect of occlusion on macular vessel density in children with amblyopia and OCT angiography. Dr. Ashok.
Good morning, ma'am. Dr. Ashok Agarwal from Army Hospital, Delhi. My study is the study of effect of occlusion therapy on macular vessel density in children with amblyopia on OCT angiography, a prospective observational study. The logic behind this: previous research has found morphological and functional alteration in the visual cortex and lateral geniculate nucleus of the amblyopia patients. The retina plays a role in the development of amblyopia is still debatable. Numerous studies have used optical coherence tomography to analyze macular structure characteristics, although the results are controversial. Recently, researchers have been able to investigate the retinal microvascular changes associated with human amblyopes using OCTA, a non-invasive neuroimaging modality. The design was patient diagnosed as a case of amblyopia based on BCVA by Snellen's chart and baseline investigation OCT angiography, stereopsis and contrast sensitivity and other anterior segment and posterior segment examination was done, and before occlusion therapy and after occlusion therapy the patient's follow-up visit was done at first, third, 6 and 12 months. Approvals, Institutional Ethics Committee of our Army Hospital Research and Referral. Inclusion criteria: newly diagnosed amblyopia cases presenting to the Pediatric Ophthalmology subunit. Age group was 6 to 14 years and patients who are willing for regular follow-up visit. Children who can maintain fixation on the spectralist OCT angiography machine will be included. Exclusion was the patient whose guardian refused or the decreased vision like congenital cataract, corneal scarring, opacities, retinal condition, maculopathies and cortical blindness. Patient with locomotor and cognitive impairments and children with nystagmus head noding will impair the image acquisition on the machine. Study design: the prospective longitudinal observational study conducted at a single center over a period of 1 year to study the effect of occlusion therapy of macular vessel density like SCP and DCP, and the other parameters were in OCT angiography on Heidelberg spectralis and visual acuity by Snellen's chart, stereopsis by TN and Randot, and contrast sensitivity by Pelliropson. Methodology: consent was taken, taking visual acuity was measured, stereo acuity by TN and Randot test, dilated direct and indirect ophthalmoscopy of the fundus of the both eye using 20D lens, OCT of macula and OCT angiography of central 6 by 6 mm square of foveal avascular zone using spectralis domain OCT, Heidelberg spectralis, HRA plus OCT was done. Children diagnosed with amblyopia will receive full refractive correction followed by occlusion therapy. Duration of occlusion will be guided as per PEDIG studies, Pediatric Eye Disease Investigation Group. Each patient will be reviewed prior to occlusion therapy, first, third, 6th month and 12 month. OCTA principle, OCTA principle is to detect blood flow by analyzing difference in repeated scans of same area of tissue by repeated motion detection, separative moving and create 3D image. This is the image of OCTA. Results variables were the age group, mean age 9.07 and the age group was at less than 10-20 and greater than 10, the 10. Gender female was 9, male 21, laterality of left to right 16 and 14. Baseline mean age and BCVA was calculated. BCVA is log in the logmar. BCVA improved. Mean BCVA was 0.42 and at 1 month it improved to 0.12 and further initial improvement was within 3 months was better and faster, and after 3 months it was slower up to 12 months. The SCP across different time intervals, that was the mean SCP was 51.27. The mean increased to 53.83 and by the end of 12 months it was SCP reached to 54.20 plus minus 13.5. The comparison of deep capillary plexus was also made and it also improved and DCP was 52.17 was initially that reached to 56.13. Conclusion, the study aimed to evaluate the effect of occlusion therapy on macular vessel density and SCP and DCP was the main parameters were included, and the improvement in both SCP and DCP indicated the occlusion therapy not only improves visual function but also enhances the macular vessel density. Take home, the occlusion therapy is the gold standard treatment for amblyopia. The study underscores the effectiveness of occlusion therapy in enhancing macular vessel density and visual function in children with amblyopia. Additionally, improvements in visual acuity, stereopsis and contrast sensitivity were observed. Thank you. Fundus examination was done, the normal fundus examination and were included, sir. Perfusion was increased, foveal avascular zone also improved, sir. Circularity improved. That on fundus examination, circularity you can observe improvement, sir.
Could you take studies beyond 12 months also?
Sir?
Are you like to take this study beyond 12 months also?
Sir, beyond 12 months follow-up is very difficult, sir.
Because amblyopia you cannot stop at 12 months also.
No,
you
sir.
have to continue.
It has to be continue and we have to reduce in the tapering manner. If we prescribe 6 hours patching for someone, then we have to reduce in the tapering manner to reduce the recurrence also.
Can you tell me one thing? Whenever the occlusion therapy is on, what actually you instruct the children to do during that time and the one eye is patched?
One eye is patched, we active to do some doodling work and some active work and active studies like work, so he can engage his worse eye to do some work.
Something very interesting is that you should tell the children to do something which they are interested in.
They're
watching,
like
they're interested in
drawing
watching TV,
and
let them watch
drawing
TV.
and the interesting activities like
They're
that.
interested in even watching mobile phone also, let
Yes,
them
sir.
watch
That
videos.
for in this respect, the CAM stimulators are also developed to increase the interest of the children.
Okay, thank you.
Sir. Sir, ma'am. वैसे मतलब actual answer is by the order of guide. The previous studies was not so clear, so they have to find out the effects. Macular vessel density will increase, then in amblyopic children the vision will improve.
Sir,
VEP also, Hamurku and electrophysiological test was done. Hamurku and et al. Study was there. One study is before in the Japan or China.
Well, most of the things what we are seeing is that basically it's the choroidal thickness and the choroidal, means all these, if they are improving also it will be here.
Choroidal thickness
Yes.
also improved in before last study. They
So
have
was it correlating with your stereo or something like that? No, or was it just the vision?
stereopsis also improved.
So do you mean that the macular vascular density improves, so the stereo improves? You don't know. Nice study, but we could do it much more.
Yes,
As
ma'am.
sir said, we could extend the period and see what else is happening in the.
Because I am posted in the RR hospital, so there were
Okay.
some patients and parents also they have transferred to their other units, so they cannot follow from a longer duration. 1 year is also very
So
difficult
what we
to
will
follow.
find, suppose now we say that the macular vascular density is like is improving and therefore the vision in those children improve more, kya? Like suppose we are doing the amblyopia therapy and we find like something.
Amblyopia therapy
If we're doing
vision
a
improved.
paper, like we have to find by what is the relevance of that paper, like basically. Good.
Thank you.
We come to the next paper, Role of Parental Smoking in Myopia, a systematic review by Dr. Divya Jain.
Good morning everyone. Today I will be speaking on role of parental smoking in myopia, a systematic review. Slide is not changing. With current myopia epidemic ongoing, we know that by 2015, half of the world population will become myopic. Parental smoking has been shown to be associated with refractive error, and literature shows mixed effect on development of myopia. So this systematic review evaluates the current evidence on the role of parental smoking in childhood myopia. This protocol was registered on Prospero, and search was done across 3 databases, that is Scopus, PubMed and Web of Science. Search strategy was designed using appropriate Boolean operators and using the following keywords: parental smoking, maternal smoking, paternal smoking, myopia, children, offspring and risk factors. The studies which had children under the age of 18 years and association with parental smoking were studied were included in this review. PRISMA 2020 guidelines were used and risk of bias was assessed using Newcastle-Ottawa scale. This is the PRISMA flow diagram showing initially 91 studies were retrieved from 3 databases, and after removing the duplicates, the records were screened and 33 records were excluded based on the inclusion and exclusion criteria from the abstracts. Then full texts were retrieved, and finally 16 studies were included in this systematic review. The data extraction was done on an Excel format using the predefined criteria. That is the demographic characteristics of the patient, exposure pattern, what is the duration of the smoking, what type of smoking was being studied, myopia diagnosis, confounding factors, whether they were adjusted or not, what was the study results, and the study quality. Now coming to the results, the sample size of the studies varied from 300 to over 12,000 children. The studies were mainly based in China, Hong Kong, Singapore, UK and United States. Out of this, 12 were cross-sectional studies and 4 were longitudinal cohort studies. The spherical equivalent which was taken in these studies as a marker of myopia was less than or equal to -0.5 diopters, and 11 studies did cycloplegic refraction on children, and 5 studies had non-cycloplegic refraction. All studies, 16 studies adjusted for common confounders, that is the age, gender, parental education, socioeconomic status and parental myopia. The exposure was collected through a self-reported questionnaires in which the parents told about their smoking habits. Biomarker validation method in terms of measurement of urinary creatinine was done in only 5 studies. The various measures of smoking were reported in these studies, like current smoking patterns, what was the maternal smoking during pregnancy, and household smoking frequency. 10 studies identified protective association with lower myopia prevalence and higher hypermetropia prevalence in the children of smokers. 6 studies reported that second-hand smoke exposure is linked to greater axial length, And it was shown in some studies that higher daily cigarette count demonstrate a higher risk of severe myopia. The risk of bias was assessed by Newcastle-Ottawa scale, and out of these 9 studies had high quality, 5 had moderate quality, and 2 were of low quality. So the limitation of evidence which we found out, the existing evidence were the self-reported parental smoking habits which could introduce a recall bias, and incorporation of biomarker validation methods, that is by measurement of urinary creatinine, was not universally done. Cross-sectional design of 12 studies, it limits the establishment of causality. And only 4 studies were longitudinal cohort design, which are more suitable for causal inference. The limitations of current review were, we excluded the non-English studies, so language bias was introduced, and we relied on electronic databases. Unpublished studies were not included in this review, which could have led to publication bias. And there was a variability in exposure, measurements, and outcome, which led to heterogeneity in the studies, and it could not be fully accounted for in data synthesis. So to conclude, this systematic review provides an in-depth analysis of association between parental smoking and childhood myopia. While findings indicate a potential link, the evidence remains mixed, highlighting the needs for further research using longitudinal study design and standardized diagnostic criteria. And public health policy should be made to educate the population about the risk of smoking, which can have adverse effect on the ocular health of children. Thank you.
Very interesting.
It was a nice study, but you didn't show the forest plot.
Ma'am, forest plot, meta-analysis we did not do. And
You didn't do the meta-analysis in this?
No.
Okay.
But your study was, the pattern was of meta-analysis, no?
Yes, yes. the
But
pattern was
because
of meta-analysis.
heterogeneity was more, and the study design also differed, so we did not do.
Even in a high heterogeneity, you can do a
Yes, ma'am.
meta-analysis
Yes,
using the
ma'am, but
random effects model.
in this we do not do that.
Okay.
ma'am.
Any more? Dr.
Curtains.
Charu, na?
Curtain since birth. Dr. Charu, is she there? No?
So where do we give this? Thank you, sir. Next session should.